Hello friends, I am Professor Ravikant, Head Department of Medicine and Division of Diabetes and Metabolism at All India Institute of Medical Sciences, Rishikesh. Today I am going to talk about the use of insulin in the control of diabetes mellitus. As we know that diabetes is not a problem of sugar, rather it is a problem of insulin. So we talk about type 1 diabetes mellitus. Insulin is literally absent. It's not produced from within the body. Whereas in type 2 diabetes mellitus, although insulin is present, it is released, but it's not able to function properly. The condition which is known as insulin resistance. And the insulin resistance comes for various reasons. For example, sedentary lifestyle, obesity, and some more, causes for insulin resistance. So I must emphasize that most of the diabetic persons think that insulin is a drug which should be used as a last resort when blood sugars are not controlled. I think this notion is absolutely wrong, and the patients must learn that since the diabetes mellitus is not a problem of sugar, rather it is a problem of insulin. Either it is reduced or there is no production within the body, or else it is not able to work properly. Hence, it is apt to give insulin when the blood sugars are not controlled. Also, it is important to emphasize that insulins are required in some stressful conditions. For example, acute diseases like infections, fever, diabetic foot ulcers during surgery, and more important, during pregnancy. These are the conditions where we have to have very tight blood sugar control for a better and optimal outcome of the disease. So, I think you must discuss with your doctor as to why the insulin is being prescribed. If there is a clear-cut indication, the insulin can be stopped after the indication is over, and the patient can resume their usual anti-diabetic drugs. Since some of the anti-diabetic drugs, they work by releasing insulin from within the body, so it is apt that as the duration of diabetes mellitus increases, the tendency of the body to release more insulin with the same dose of drug is reduced. Hence, you require a higher dose. The dose escalation is there, or you have to add new anti-diabetic drugs. But at one point of time, the drugs may fail, so you need to use insulin at that particular time. But the good part with insulin is it can bring down the HbA1c to the desired level, which is not achieved by any anti-diabetic drug so far, which is available in the market. So, for example, the HbA1c can be brought down right from 15 to 7 by insulin alone, whereas no other drug can bring it from 15 to 7. So, the HbA1c lowering potential is maximum with insulin. And second notion is the people think that once the insulin is used, it will be required forever and they will become habitual to insulin. I think this is absolutely a wrong notion, and I have already talked about for an indication. If the indication is temporary, then you can stop it as well. And if it is the case of failure of the anti-diabetic drugs, that you may need to take it for a long time, but it is not harmful. It is always beneficial to the patient to keep their blood sugars controlled, and the good part with insulin is it gives a more energy, a muscle mass, healing power to the patients. So whenever your doctor prescribes, do not hesitate to start the insulin well in time. Thank you very much.